So, how are you going to be performing? You ready? All right, how are you going to be performing? The patient assessment pretty much starts like every other skills, BSI, scene safety, MOI, NOI, number of patients, need for additional resources, and C-spine precaution. All right, as you approach the patient, you're forming your general impression. I see a mannequin laying on a stretcher supine, right? Obviously, at this time, we're going to be looking for any obvious life threats. Are there any? All right, then you approach your patient. Sir, are you okay? Are you okay? Are they responsive? No. All right, so I'm going to start pinching. Are they responsive? No. All right, I'm going to check for a carotid pulse. Do I have a carotid pulse? Yes. Okay, at this point, I'm going to open the airway with a modified jaw thrust. What do I see? You see blood. I'm going to suction on the way out, no more than 15 seconds. Is my airway now clear? Yes. I'm going to insert the OPA. Does my patient accept it? Yes. Okay, at this point, I'm going to ventilate my patient with a BVM at 15 liters per minute of high concentration oxygen. I'm going to expose my patient. What do I see? You see 2 penetrating wounds to the left side of the chest. I'm going to treat them with an occlusive dressing. I'm going to put them on my stethoscope and I'm going to listen. 1, 2, 3, 4. What do I hear? Absent, clear, whatever, right? And of course, I'm going to palpate. All right, after I'm done with breathing, I'm going to check radial pulses. Are they present or are they not? If they're not, then you're going to go back to the carotid to make sure. All right, I'm going to look at my CTC. What's my color, temperature, and then of course condition. All right, so I'm looking for color, temperature, and condition of the skin, and I'm going to check the voids for any additional bleeding. Any blood, any blood, any blood, any blood. If my patient is exhibiting signs of shock, I'm going to treat for shock, elevate the legs, keep the patient warm with a blanket, and continue oxygen treatment. All right, at this point, I have a male or female patient. Whatever happened to that patient, found whatever, how it was found. Remember the report, that last report, right? I'm not going to go through it because there's no scenario. At this moment, I'm going to move on to a secondary assessment. Can I get a sample history from anybody? No? Okay. At this point, I'm going to start going head to toe. I'm going to palpate the head, the frontal, temporal, parietal, occipital. Do I see anything? I'm going to look at the eyes. Do I see any raccoon eyes? I'm going to look behind the ears. Do I see any battle signs? I'm going to look in the nose, mouth, and ears for any cerebral spinal fluid. I'm going to flash my pen light onto the pen. Are the pupils equal and bilateral? I'm going to palpate the face, starting at the maxilla, going to the mandible. Now I'm going to move on to the neck, palpate the back of the neck, move my way forward. Do I see any tracheal deviation or JVD? No? Right, at this time, I know what we say about the collar. This is just how I like to say it, so I'm gonna do it. I'm gonna apply the collar right now. And I'm gonna move on. I'm gonna inspect. Do I see any changes or decap ETLS other than the initial treatments? No, all right? So I'm gonna palpate and then listen again in 6 places. 1, 2, 3, 4, and if you could get 5, and if you could get 6. Okay, I'm gonna move on to my abdomen. I'm gonna inspect. Do I see anything? Yes or no? All right, at this point, I'm gonna move on to palpation. Palpate, palpate, palpate. Do I feel anything? No. I'm gonna move on to the hip. Push down, push in. I'm gonna look at the 1%. I'm looking for any blood, any urine, any feces, and of course some priapism. I'm gonna palpate both legs at the same time for symmetry. Palpate each individual leg, right? Checking perfusion motor sensory, right? Do I feel a pulse or do I see perfusion? Do I get motor sensory functions? Same thing with this leg. Tickle, tickle, tickle. All right, do I feel anything? What I gotta do in the front to the bottom, I gotta do to the top. Palpate again. Palpate again. Obviously, since my patient's unresponsive, I'm unable to get motor sensory functions, but I'm still able to get perfusion. 1, 2, 3. Same thing, I'm unable to get motor sensory functions, but I'm still able to access perfusion. At this point, I'm gonna roll my patient over. I'm gonna palpate the spinal column to see if there are any step-offs or any swelling. I'm gonna do an S around the back, look at my hands. As I get towards the glutes, switch my hand over, palpate, palpate, palpate. Place the patient onto a longboard, place the patient into a stretcher. At this point is where you get your vitals. Blood pressure, systolic, diastolic, heart rate, rhythm, and quality. So 60, strong and regular. Respirations, rate, rhythm, and quality. So 16, full and adequate. Don't forget your CTC again. All right, don't forget to check your pupils. At this point, after vital signs, I'm gonna treat any additional wounds that are non-life threatening, and I'm going to reassess my patient every 5 minutes, and I'm gonna transport this patient to the nearest trauma center. I'm done.
Beautiful.
Good with that? All right, good.